So we're going to be heading out here shortly. I'll be back tomorrow, about 24 to 36 hours to check on you guys. But in the meantime, I just want to give you some instructions and just talk about what to expect in this first day or so. So for you, your job is to feed yourself, feed your baby, and get some rest. Rest is crucial in this postpartum period. You are recovering from a very physical event of labor and birth, and you're also becoming new parents, which is incredibly emotionally and mentally draining. So get as much rest as you can. I know that it's kind of cliche, but really truly sleep when the baby is sleeping as much as possible. You're not going to have an 8-hour block of time to sleep at night anymore because you'll be caring for a newborn. So we're talking about around the clock sleeping, getting rest anywhere you can. And as far as nutrition goes, keep eating all those wonderful, nourishing foods you were focusing on in pregnancy. Healthy fats, lean protein, fresh fruits and vegetables. Again, it's going to aid in the recovery of your body. And you're still growing a human being. They're just on the outside now. As far as hydration goes, focus on water. That should be your main beverage. Try to avoid sugary drinks or drinks with caffeine. And if you need a number, I recommend people trying to shoot for about 2 quarts of water a day. But if you're drinking to thirst, then you should be right on track. When you go to the bathroom, I want somebody to go with you during these first 24 hours, and that's just because, your equilibrium may be off, your sense of balance could be off a little bit, and so just for safety's sake, have somebody accompany you to the bathroom. You're going to use a peri bottle with warm water after you pee or have a bowel movement to spray off your perineum and then just pat dry. No wiping or rubbing at this point. We don't want to irritate that tissue any more than it already is. You did have a 2nd-degree tear that we repaired with a few sutures. Those will dissolve in about a week's time. In this first 24 hours, you can use the icy pads that are in your freezer, both for pain control as well as to help minimize the swelling. Additionally, you're going to want to pay attention to how you're sitting, making sure that your knees are close together, so avoiding crisscross applesauce. You also avoid the stairs as much as possible, and don't lift anything heavier than your baby for these first few weeks. You're bleeding right now. You're going to bleed for 4 to 6 weeks about. Right now it's heavy, kind of like a heavy menstrual period. You may have gushes, you may have small clots, but I want to know if you are soaking one of the maternity pads or more in an hour, or if you have clots larger than the size of about an egg. Those are things I want to know about. You may experience after pains from the uterus, shrinking down to its non-pregnant size. A water bottle or a heating pad on your abdomen can be very comforting, but if you need to, you can take Tylenol for the pain. I also want you to check your uterus every so often, like we've been checking since you've had the baby, and you're going to do that by making like an H shape with your hands and putting your thumbs at about your belly button. You press in and down until you feel the uterus, which should feel like a firm grapefruit. If it's off to the side, that probably means that you need to pee. If it's soft, then just massage it until it firms up, and that just prevents you from losing more blood than you need to. As far as breastfeeding goes, you're going to pay attention to your baby, not the clock, and feed on demand. You're watching for early signs like rooting, head bobbing, hand to mouth, sticking the tongue in and out. Those are all early signs of hunger, and they'll probably show those about every 2 to 3 hours is usually what they want to be nursed at. Crying is actually a late sign of hunger, and we want to avoid getting to that point just because it's really difficult to latch on a baby who's so hungry that they're crying. As you start this breastfeeding journey, you may experience sore or tender nipples. Using lanolin is soothing and can help ease some of that discomfort. Additionally, when the baby is latched on, that tenderness or soreness shouldn't extend beyond 20 to 30 seconds. If it continues to be painful, then that's a sign that the latch is not as good as it could be. So you'll break the suction like we talked about, where you stick your pinky finger kind of alongside their cheek and break the suction before removing them from your breast. And then just try to get another deeper, better latch. Don't just grin and bear it, because that's just a recipe for cracked or damaged nipples, which can really interfere with the breastfeeding relationship. We are going to expect baby to poop once and pee once in this next 24 hours. When you do a diaper change for her, make sure you are wiping front to back and getting in between all the folds and creases. As far as her umbilical cord is concerned, you're just going to keep that clean and dry. There's no special care required for the umbilical cord. Do fold the diaper down in front so that it's underneath the cord, so that it won't irritate it and that the cord won't get wet or dirty in the diaper. Newborns have difficulty regulating their temperatures, so you're going to monitor her temperature about every 4 hours. It should be between 97.7 and 99.9. If it's on the lower end, you can put another layer of clothes on her or a hat. If it's on the upper end, just take a layer off. Although the best place for the baby to be to excuse me, to help her regulate her temperature is skin to skin with you, with just a blanket over top. If she's not going to be skin to skin with you, or if other people are going to be holding her, the best rule of thumb to go by is putting her in one more layer of clothing than what you're comfortable in for the situation. Babies breathe kind of irregularly. They don't have a consistent rate like adults do, so you may notice periods of short, shallow breaths, quick shallow breaths, or periods of longer, deeper breathing. That's all normal, as is sneezing, which helps clear the airways from more of that fluid that was in there from when they were inside. That's all normal, but it is not normal for babies to have to work to breathe. So you shouldn't see or hear any gasping or grunting. You shouldn't be using their abdomen to breathe. You shouldn't see their ribs when they're trying to breathe. Those are all reasons to call me and things to let me know about. Additionally, if their coloring is anything other than like a nice pink undertone, like if it's dusky, if they have purple around or blue around their lips or their mouth, that I would like you to call me immediately. Jaundice, which is the yellowing of the skin, is pretty normal in newborns, but it's never normal in the first 24 hours. So if you notice tomorrow that her eyes have kind of a yellow hue, the whites of her eyes have a yellow hue, or her skin has a yellow tint to it, please call and let me know right away. Other things to call me for would be bleeding or oozing from the umbilical cord site, or redness around the base. No interest in nursing, or too sleepy to nurse, or not latching long enough to get milk to transfer would be reasons to call me. If the baby seems excessively drowsy or excessively irritable, please call me. Or for anything else that you're concerned about, I'd rather have you call me and we figure out that it's just normal than you to brush it off and it to be something that is a concern and needs to be addressed that we missed. As far as you go, again, please call me if you are soaking more than one pad in an hour, or have clots larger than about the size of an egg. If you have severe pain, sharp pain, or increasing pain, especially in your abdomen or your vulva, I want to know about that. If you're experiencing flu-like symptoms, a temperature greater than 100.4, if you have redness, pain, or like a lump-like firmness in your breasts, cracked or bleeding nipples, I want to know about those things. Additionally, if you aren't able to pee or are having difficulty urinating, I want to know about that. If you have pain, redness, swelling in your calves, or difficulty breathing, or pain in your chest, those are all things that you should let me know about as soon as possible. I know that was a lot of information to just throw at you right there. I do have it all written down. I'll be leaving that with you so that you can look back on it if you need to. I'm always available by phone, so call me for anything. Do you have any questions at this point about anything that I just talked about? Okay, well then let's get set up for that next appointment tomorrow.